I'm Dr. Reza Momini, and I'm a board-certified plastic surgeon. One of my specialties is hand surgery. For a long time, surgeons have treated Dupuytren's contracture, which affect the fingers of most elderly Caucasian men and sometimes women, with surgery. Recently, the FDA approved a medication called Xiaflex. Typically, when we inject this medication, this is done in a 2-day sequence. In this patient, one can see that the ring finger of the patient is contracted, and when he opens and closes his finger, he's unable to open the finger any more than a 45-degree contracture. The finger is first prepared by injecting a little lidocaine. This has been done before the video. In this sequence, you can see the injection of the actual Xiaflex medication, which is a collagenous enzyme, into the Dupuytren's cords that are tightening the finger. This is done with a sequence of a few small injections under local anesthesia. Once this is completed, we make sure that there's no bleeding or discomfort for the patient and place a bandage on the patient's hand overnight. The patient is asked to elevate the hand and not to perform many activities. The following day, we have the patients return to the office so that we can manipulate the finger joint and try to see if we can open the joint. You can see that it's typical for the patient to have some bruising and swelling at this time from the injection the prior day. After a little local anesthesia is injected so that the patient is comfortable, we make sure that the area is numb, and once the patient confirms it, we try to work once or twice very gently on the contracted finger. In this video, you can see the gentle pressure on the finger allows the finger that was very tight the previous day to slowly open up into a complete opening. In this case, this patient hasn't been able to open his hand for many, many years up to this point. The patient is asked to flex and extend the finger at this point, and one can see excellent function one day after the injection. If necessary, we can perform a small additional manipulation.